Welcome to the Edmonton West Primary Care Network's Report to the Community. Our family physicians are key to our patients' medical home, providing patients the access they need to a dedicated team of health professionals who are driven to care for them throughout every stage of their life.
On behalf of our Board of Directors, welcome to the Edmonton West Primary Care Network's inaugural report to the community. Our work is about enhancing primary health care for people who live in West and Southwest Edmonton through collaborative and innovative relationships. The Edmonton West Primary Care Network was one of the first PCNs in the province. We started in 2006 and at the end of that year had 15 family practice clinics involving 54 physicians caring for 70,000 patients. 12 years later, we now have over 180 physicians caring for over 178,000 patients and are proud to say that we are making a difference in how primary care is delivered in our area with the help of over 100 PCN team members. A major concept we believe in is in providing our patients with a true medical home that they can count on. A key component is recognizing the need for team-based care, as we know that one provider cannot do it all. In some situations, you will see these team members at your family physician's clinic, and in other circumstances, you may see them in the Meadowlark Health Centre. Also, you may not see some of our important members who work in the background to ensure you get the best care available for preventative screening tests such as mammograms or cholesterol testing.
I'm a part of the Edmonton West Primary Care Network.
I'm part of the Edmonton West Primary Care Network.
I'm part of the Edmonton West Primary Care Network.
I'm part of the Edmonton West Primary Care Network.
Our mission is to support family physicians in improving primary care through relationships, collaboration, and innovation. Our vision is to provide the best primary care to our community. We value integrity, respect, compassion, and being patient-centered. As practicing physicians, we are proud of the diversity and the wide range of experience that our board members bring to the Edmonton West Primary Care Network's decision-making process.
Our greatest advance this year has been the progress we've made helping our family physicians enhance the medical home model of care. The medical home is where patients can access seamless care that is centered on their medical needs in a timely manner within their community at every stage of life.
So I think the PCN and my role specifically at the PCN fits very well into the medical home model. It kind of serves as a one-stop shop for the patient in terms of all of their needs. I'm able to refer patients to other services within the PCN in a very timely manner. I love my job because of the difference it makes in people's lives.
We tend to have a very cooperative effort with often seeing the patient first, doing the assessment, reviewing diet and exercise and all the other things, and then consulting in terms of medication and approach to the patient. It enables us to have a team approach, to tap into resources that do not normally have.
Our Frail Elderly Outreach Program attends to the complex social and medical conditions of many seniors in our community. 253 elderly patients benefited this year from this continuity of care.
The program was developed about 3 years ago and need was identified by the physician to look after those people who have difficulty getting into their clinics for whatever reason. So we extended the medical home into the personal home of those individuals so that they could be looked after. We have a nurse practitioner who does all forms of primary care. We have an occupational therapist and an occupational therapy assistant who set up exercise programs to increase their mobility and their quality of life. We have an RN that goes out and supports what the nurse practitioner does, and there's myself who looks after their medications and ensures that everything is appropriate. We are very collaborative with the physician in the clinic to make that care truly interdisciplinary.
That's not all. The collaborative work of our social workers within the medical home is critical to addressing the complex issues affecting the health and well-being of over 1,000 patients this past year.
People need hope when things start falling apart for them. And as social workers, we identify what the issues are and we help them find solutions. And it gets quite complicated at times, so we're doing a lot of researching to find out the answers to these individuals' concerns.
We see patients who have multiple social, economic issues, and For me to be able to handle it and be knowledgeable of what's up to date is really not possible, but to be able to utilize a social worker is a great measure and a great advantage.
The Edmonton West Primary Care Network's Lower Leg Assessment Clinic is part of the medical home as it strives to prevent disease, illness, and injury. Last year, 673 patients were educated, treated, and cared for at the Lower Leg Assessment Clinic.
We tend to see clients in our clinic that have chronic lower leg swelling, who have wounds or ulcers that are having a hard time healing, and we also perform vascular studies to determine blood flow to the lower extremities for clients.
It's clear that through our family physicians and the medical home concept of care, patients get reliable healthcare they can trust. And the Edmonton West Primary Care Network's healthcare providers are leaders in caring for patients through the medical home. We are proud of the care and support we provide to patients each day. We are the Edmonton West Primary Care Network.
I'm part of the Edmonton West Primary Care Network.
I'm part of the Edmonton West Primary Care Network.
I'm part of the Edmonton West Primary Care Network.
I'm part of the Edmonton West Primary Care Network.